Hi, this is Piyush Bhargava, and I have a few interesting cases to share with you. This is the first case. We were reading the CT scan of the abdomen and pelvis in this patient with history of prostate cancer and known bone metastasis. And this is a scan we were reading. Compared to the prior, it seems like the lesions are getting worse. Maybe there is a new lesion here. And then when we looked at the bone scan, here's a prior bone scan showing multiple foci of intense uptake consistent with osteoblastic bone metastasis. And this was a more recent scan suggesting interval improvement, and their PSA improved too. So putting everything together, we made the diagnosis of flare phenomena seen on CT. Here's a good article on that. The CT flare response of metastatic bone disease in prostate cancer. Case number 2, this is a patient with newly diagnosed right upper lobe lung malignancy. They got a whole body FDG PET CT for staging, and we found this uptake in the mediastinum, and this focus corresponded to fat in the interatrial septum, and the diagnosis here is lipomatous hypertrophy of the interatrial septum. Here is a good article on that subject. We want to differentiate, we want to recognize this abnormality so that we don't upstage patients with cancer. Our next patient had a prior DEXA scan which shows osteoporosis. On the follow-up scan, there is a compression fracture of L4 vertebral body, and because of that reason and the sclerosis and overestimation of the bone mineral density, this time the T-score is not less than 2.5, but they have not just osteoporosis but a WHO category called severe or established osteoporosis, because we have a insufficiency or a fragility fracture that we saw earlier. Our last case, this is a patient with renal transplant, and these images are from the technetium-99m mag3 renal scan showing good blood flow to the transplanted kidney in the right hemipelvis and relatively preserved function. It makes some urine which is seen in the urinary bladder, but also urine is seen outside the kidney draining through the post-surgical drains. And so this patient has urine leak. Urine leaks are important complications post-transplant. They're rare. They're seen in the early post-operative period and generally are due to necrosis of the ureter at the site of transplantation into the urinary bladder. This is a good article that talks about that. Thank you for watching.